Assalamu alaikum. Welcome all to Easy Human Anatomy channel. Today I discuss axilla, one of the important topics of the superior extremity. Axilla is a four-sided pyramidal shaped space which is situated in the upper part of the arm and upper part of the lateral thoracic wall. This is apex, this is base, and this is the anterior wall, this is posterior wall, this is medial wall, and this is lateral wall. The coaxial via which is communicated with the posterior triangle of the cervicoaxillary canal are anteriorly the middle third of the clavicle, posteriorly superior border of the scapula, and medially the outer border of the first rib. This is base. This is base. The base is formed by the skin to remove here, then superficial fascia, then dome-shaped axillary fascia. This is axillary fascia. The axillary fascia is derived from the deep fascia of the upper limb, and it is continuous with the pectoral fascia. And in the deeper part, it is also continuous with the clavipectoral fascia. The anterior wall. This is anterior wall. This is anterior wall. It is formed by the pectoralis major, clavipectoral fascia. This clavipectoral fascia encloses two muscles, plexus muscle, which is situated in the inferior surface of the middle third of the clavicle, and this is the pectoralis minor. And this clavipectoral fascia is continuous with axillary fascia. So this is the clavipectoral fascia. It encloses the plexus muscle, then pectoralis minor, then continues with axillary fascia. And we can see the clavipectoral fascia and pectoralis minor when we cut the pectoralis major muscle. This is posterior wall of the axilla from the pectoralis major. This is posterior wall formed by the latissimus dorsi. This is the lateral wall, and this is the medial wall of the axilla. Pectoralis major is cut here, and below the pectoralis major, due to the pectoralis major, this is the location of the pectoralis minor, and this is the medial wall of the axilla formed by the serous anterior muscle. So now the posterior wall is formed by the scapularis, teres major, and latissimus dorsi muscle. And this is the medial wall is formed by the serous anterior muscle and upper forearm. The lateral wall is formed by the upper part of the humerus, intertubercular sulcus with long head of the biceps brachii, short head of the biceps brachii, and cobrachis muscle. So this is the long head of the biceps brachii present at content in the bicipital groove, and this is the short head of the biceps brachii and cobrachis. This is from the lateral wall of the axilla. This is medial wall of the axilla formed by the serous anterior muscle. The posterior wall is formed by the subscapularis and teres major and latissimus dorsi, which is attached in the floor of the bicipital groove, and major, which is attached in the posterior lip of the bicipital groove. This is pectoralis major. This is pectoralis minor. Now the content of the axilla. In axilla, you can easily identify axillary artery due to its firm consistency. And it is very important to identify axillary artery because cord of the brachial plexus is situated around the axillary artery. So in the medial part of the axillary artery, medial cord is present, lateral cord is present, and posterior to the axillary artery, posterior cord is present. So this is the lateral cord, and you see from the lateral cord, musculocutaneous nerve is arises. This nerve mainly supply muscle of the anterior compartment of the arm, biceps brachialis, and coracobrachialis. This musculocutaneous nerve is fires coracobrachialis and become continuous with a cutaneous nerve, lateral cutaneous nerve of the forearm. Due to this peculiar nature, this nerve name is the musculocutaneous, means it spares coracobrachialis muscle, and cutaneous means it is and as a cutaneous nerve, the lateral cutaneous nerve of the forearm. This is the ulnar nerve arises from the medial cord, and it is mainly supply the muscle of the hand and few muscle of the forearm, and it is situated behind the medial epicondyle of the humerus, which is situated in the lower part of the humerus. If we remove the axillary artery, we find the posterior cord. From posterior cord, two nerves arise. One is radial nerve and another is axillary, not showing here. So the content of the axilla is the axillary artery and its branches, axillary vein, axillary group of lymph nodes, and axillary tail of the mammary gland in case female, and cord of the brachial plexus, which is situated around the axillary artery, and also the long thoracic nerve supply gyrus anterior muscle, which form the medial wall of the axilla, intercostal nerve, and axillary fat and alveolar tissue. Now, anatomy of the axillary sheath. It is a tubular sheath that surrounds the axillary artery, vein, and brachial plexus. It acts as a protective layer and provides path as they pass from the neck arm. It is continuation of the vertebral fascia from neck and provides continuity from cervical region to axilla. It has clinical importance. The prevertebral fascia of neck continues laterally as axillary sheath, which surrounding axillary vessel and brachial plexus. This continuity allows cervical tuberculous pass to track down into the axilla. Now, the axillary lymph nodes. There is 5 lymph nodes present in the axilla: anterior group, posterior, lateral, central, and apical. Here is the definition of this group: anterior group, posterior group, lateral group, central group, and apical group. And the anterior axillary group, it's drained the anterior chest wall, upper part of the abdominal wall, anterior abdominal wall, and also the lateral part of the chest. The posterior group of lymph nodes drain upper back and posterior thoracic wall and scapular region. The lateral group drain upper limb and central group. All 3 lymphatic are drained into the central group: anterior, posterior, and lateral. And from the central group, this all lymph goes to the apical lymph group. Apical lymph node receive all other axillary nodes and also receive drainage from the head neck region. That this apical group, this apical group, subclavian trunk and subclavian lymph trunk of the right side is drained into the at the junction of the internal jugular vein and right subclavian vein. In the left side, left subclavian trunk is drained into thoracic duct. This thoracic duct drain into the left internal jugular vein and left subclavian. Now the branches of axillary artery. At first, extension of the axillary artery, it is extended from the outer border of the first rib to the lower border of the teres major muscle. The subclavian artery has only impression in the first rib, the group for subclavian artery. This artery also crosses by the pectoralis minor muscle, and this muscle it can be divided into three parts: anterior part, first part, second part, and third part. The first part, the branches is superior thoracic artery or supreme thoracic artery. In the second part is situated deep to the pectoralis minor muscle, and here to branch the thoracoacromial artery and lateral thoracic artery. From the third part, important blood vessels arise: anterior posterior circumflex humeral artery, which is surround the surgical neck of the humerus, and also another important artery, subscapular artery. Now a problem is question: a 35-year-old man suffered deep cut in his axilla from an accident, leading to numbness and weakness in his shoulder. He is unable to abduct his upper limb. Which nerve in the axilla is most under abduction? Axillary nerve. Which muscle is innervated by the? How does this affect shoulder movement? Deltoid, it paralyzes impaired shoulder abduction beyond 15 degrees. The first 15 degree is done by suprascapular muscle. So supraspinatus. Other might also be affected by the axillary nerve injury, and what is its function? The teres minor, which assists in lateral rotation of the arm. A 45-year-old woman present with painful swollen lymph node in her axilla following a severe skin infection in upper limb. Which group of lymph node is most likely enlarged due to the infection in the upper limb? Lateral group of the axillary lymph node. How do axillary lymph nodes play a role in filtering lymph from the upper limb? Lymph from the upper limb drain into the lateral nodes, then to the central node, apical node, subclavian lymph node, then it's drained into the venous system and systemic circulation. So this is the axilla of the axillary region. This is the location of the axilla. In sonography, this is the location of axillary artery, and here the locations of the important nerve arise from it. Nerve arises from the medial cord, the musculocutaneous nerve arises from the lateral cord, and the radial nerve arises from the posterior cord. Some axillary lymph nodes collectively drain the entire upper limb, breast, and thorax above the umbilicus, and upper abdomen above the umbilicus. So this is all about the axilla. In the skeleton, the location of the axilla. Here the apex, this is the base, this is lateral wall, here. So there is a link uh, for Google form, and you find some quizzes. Try this. Thank you for watching. If you find this video helpful, please share this video and please subscribe my channel.